Yeah, hi, I'm Christopher Maduri. I'm an interventional cardiologist at Piedmont Heart Institute in Atlanta, Georgia, and part of the Marcus Heart Valve Center. So aortic stenosis is a disease of aging. We know that it actually afflicts about 2% of people over the age of 65 in the United States. It is a disease that continues to progress over time, so if you have actually had that disease develop, it's not going to get better on its own. Unfortunately, for patients that do have it and progress to a significant level, they have very severe symptoms. So these initially start with shortness of breath, and then occasionally can develop in chest pain, and then eventually passing out. We know that at the onset of symptoms, the average life expectancy is only 2 years if it's left untreated. So because of this, we feel it's very important to consider early treatments for these patients when symptoms do develop. So conventionally, the treatment of aortic stenosis has been surgical aortic valve replacement, and this requires a sternotomy, or cutting open through the chest, opening it up, and cutting out the old valve and replacing it by sewing in a new valve. So opening up their chest really leaves a significant risk of not making it or having significant complications or prolonged recovery from the procedure. Because of this, people were constantly investigating easier ways to replace a patient's aortic valve. And in 2002, in France, they discovered or did the first-in-man procedure of transcatheter aortic valve replacement, or TAVR, that allows a much more minimally invasive way for replacing someone's aortic valve without having to open their chest. And hopefully, we've seen so far, improves outcomes and also really greatly improves the ability to recover in these older patients. Transcatheter aortic valve replacement, or TAVR, is really a great step forward in medical technology. This procedure is performed in a minimally invasive approach. So instead of cutting somebody's chest open, we're actually able to go in, usually through the groin, feed a catheter up, and then put a catheter across the aortic valve. We'll then crush the old valve up against the wall with the stent, and inside of that stent will be a new valve that functions just as well as the old valve did. At the Marcus Heart Valve Center, we typically see patients in clinic for the first time. At that visit, we'll discuss with them what aortic stenosis is and what the typical evaluation and course of treatment is. Most commonly, they'll be myself or my colleague, Dr. Vivek Rajagopal, one of the cardiologists, as well as one of our cardiac surgeons, to determine what their real risk is for surgical or transcatheter aortic valve replacement. At that time, we'll discuss with them, and if it's their wish to proceed with doing something to treat their heart valve, we will then set up further testing. Other testing includes a heart catheterization to evaluate their coronary arteries, as well as any other issues that may affect the ability of us to adequately treat them for this procedure, an echocardiogram, a cardiac CT, which is going to allow us to adequately size both the valve that we will replace, as well as the arteries in the legs. And we'll also perform a carotids testing, as well as pulmonary function testing. All of this is to try to optimize this patient's ability to have a very successful procedure.